Well, hello. I'm Dr. Laura Fanamore, and I am excited today to have the opportunity to talk with Melissa Harlan. Melissa is a peer at the University of Pittsburgh School of Nursing, where she is an assistant professor. And Melissa is a graduate of our DNP program for clinical nurse specialty, and her area of concentration was in adult health. Melissa, thank you so much for joining us. Let's begin by having you tell us a little bit about what your current role is and how you've functioned as a clinical nurse specialist. Melissa?
Absolutely. Well, I'm glad to be here with you today, Laura, and thank you for inviting me. So I am currently, as Laura had mentioned, an adult health clinical nurse specialist working in an academic setting, but also continuing with faculty practice. So my role is twofold in the sense that I am working with students in academia and guest lecturing and helping to teach some classes, but I'm also still very involved in the clinical setting. Of course, whenever I'm working with students in clinicals, but also whenever I am working at UPMC Shadyside with a team of advanced practice nurses there also. So I'm still actively working on quality improvement projects and helping them to monitor their systems and processes and still fully utilizing the CNS role.
Very good. So how did you decide on the clinical nurse specialist role? Tell us a little bit about what was appealing about that role and why you chose the University of Pittsburgh for your graduate studies.
Sure, absolutely. So I think that's a great question. And for me personally, I know that I like flexibility in my workplace, and I don't like to have the same workday every day. I like a challenge, and I like to learn new things and have new opportunities to just work with different projects and different groups of people. And with the CNS, we actually function in 3 different spheres of influence. So at the center, of course, is our patient and our family sphere. Then we also help to work with the nursing staff and the support staff. And then our last, or our outer sphere, is the actual healthcare system. So I really have the ability to make an impact, not just with the individual family. So for example, if we have a really challenging patient on the unit in the sense that they're in critical condition or just need some extra care or support from the staff, I'm able to serve as a consultant for them. Also, helping to, look at just major problems across the system. So I really feel like I can have an impact at a few different levels. And in terms of why I chose the University of Pittsburgh, honestly, I did not want to feel like I was just a number, and I wanted to know that I was getting a good quality experience. It was important for me to be prepared to enter the field, knowing that I was confident and capable of fully working in the CNS role. And so I've just had the opportunity to have so many great mentors at Pitt and to be able to work not just with students, but with my peers and nurses throughout the UPMC healthcare system, and really feel like the faculty have heavily invested in my education, but also just in my personal and professional growth. And so I really appreciated just the extra time and attention that I was able to receive as a student and how that has continued and the support that I've received as a faculty member. So it's just been a privilege and a joy to be able to then return that to my students.
Well, hail to Pitt. You certainly
Absolutely.
gave a very nice tribute, and does our faculty hearts good to hear those kinds of messages. But I want to come back to some things that you mentioned in terms of the role, and I wondered if you could give us some examples of, what's an example maybe of a patient situation where the nursing staff say, "Hey, Melissa, we need your help."
Mm-hmm. Yeah, so that's a good question. One example that I can think of that has come up recently within the past several months, I'll say, is a situation where we had a patient that just had a lot of different issues with their skin and with some different dressing changes and without getting into too many details, just some particular needs for wound care.
Mm.
So, as many of you probably know, especially in our larger healthcare systems, we're very fortunate to have specialized teams, but it doesn't always mean that somebody from that particular system-wide team is available. So, I was able to serve as a consultant for some of our staff members and to just really work with them to do an assessment on the patient, to look at their care needs, to identify why we were continuing to have issues with these particular wounds or dressings, and then to help work with the staff to identify some potential solutions for that. And, I know that that is kind of maybe a more simple example, but in a lot of situations, what it really comes down to is that we have patients who are becoming more and more ill and suffering from more and more chronic health conditions. And we need to be prepared to care for those patients even whenever they're not in the intensive care unit. And in fact, we shouldn't really be expecting all of them to be in the ICU. That's certainly not what we want. So just being able to round on that patient more frequently, to, kind of share some of that responsibility with the nurse and to say, yes, you'll be, performing your primary duties, but I'm also going to be checking in 2 or 3 times today to assess the patient's needs, the family's needs, and to just offer that additional level of support. And again, that's allowing me to work across a few spheres of influence. So we're starting with the patient and the family care, and then we're extending that out into the staff care and development as well. And I just appreciate having that dynamic interaction while I'm performing the same responsibility.
Great example. And that leads me into a discussion about your influence with the system. And I know that your DNP project was one that was targeted at improving quality at the system level. So can you tell us a little bit about how your scholarly project helped to influence care at the system level?
Yes, absolutely. So I think this is another exciting example of really utilizing that CNS role to the full extent and working across all of those scopes of practice. So we had seen that actually about a year or so before I started my project, I was able to start working in my clinical role or for my clinical practicums with a wonderful group of nurses at UPMC Shadyside. And what we found is that we were in the process of implementing a bundle for central line care. So really standardizing the way that we were taking care of our catheters and just trying to minimize any potential routes of infection. The nurses worked really, really hard to just come up with this amazing bundle. But what we saw is that even after it was implemented, we were still having issues with infections. And the nurses were, whenever we did our observations and our competencies, we were seeing that they were complying with all of the practices that we were asking them to do, but we weren't really sure why the infections were still where they were. So that really enabled me to step in at that point and to look to try to identify some of the barriers. And through my project, I was able to see that there were some situations where nurses maybe, were newer to the hospital and didn't fully understand the bundle or weren't, documenting things appropriately. So basically they weren't taking credit for all the work they were doing. Mm-hmm. And through my project, I was able to do a focused site survey. So really looking at the nurses, doubts or discouragements or just their issues that they were having with the bundle at the unit level, and then go back and address those through some education and some extra support. And what we saw is that by tailoring those interventions to specific unit needs, we were actually able to have an impact across the healthcare system and reduce those CLABSI rates. And so it was just, again, a very exciting opportunity to identify a gap in knowledge, to say we've worked really hard, we have this, these great processes in place, and we know nurses are great at understanding EVP and wanting to use that. But there are also some challenges that we need to think about. And sometimes that doesn't always happen whenever we're, very excited or very motivated about a project. So I was able to just help the team refine some of our processes and think a little bit differently about the way that we were implementing the bundle or what we were asking the nurses to do with that.
I'm so glad you used that phrase, think a little bit differently. You know, in our first year seminar with students, one of the things the faculty have talked with students about is what's it like to think like a nurse, and how the use of EBP or evidence-based practice helps us to really look at what is the best evidence that supports the use of this particular practice, or in your case, this particular bundle of different strategies and techniques that are designed to try to minimize the risk of infection to the degree that was possible. So great. That sounds like that was a fun project, and certainly one that made a difference. And you know, all of us, when we come into nursing, choose this profession because we want to make a difference. And so let me ask you, thus far in your career, knowing that you're a relatively new CNS and a relatively new faculty member as well, what are you proud of so far in your professional career?
Well, I think that one of the things that I am most proud of is that I truly feel like each day whenever I come in to work as either an educator or a CNS, or truly both at the same time, I think is what normally ends up happening, that I truly feel like I'm making a difference. And that might look different each day. One day it might be providing some extra time and support to a student. The next day it might be working with the team of EPRNs at Shadyside and just helping to take care of the patient population there. But I just really appreciate being in a position where I feel like each day, whenever I end the day, I know that I have helped somebody and that I've been able to make a difference in one person's life, if not more.
It sounds like you're very happy with your choice as for both graduate study and in your role as a clinical nurse specialist and now academic educator. Getting there probably took some time. Talk a little bit about what that journey was like for you and how you balanced both working as well as studying.
Absolutely. And I think that's an important consideration, especially whenever you're juggling other work responsibilities and family and just a lot of other life events. And again, that was one thing that I really appreciated about the CNS role and the flexibility that I had with the program at Pitt. So I actually got my master's as an adult health CNS first, and after graduation left the country and performed some community health nursing before I came back and obtained my doctorate from Pitt and started teaching. So I had a lot of flexibility and was really able to work the program around the other things in my life that were important to me. So traveling, spending time with my family, and still being able to advance my career and my education. So whenever I joined the master's program, it took me probably about 3.5 years. But again, it does not need to take that long. That was my choice to kind of stretch that out and just slowly, work my way through the program so I could have a little more of a work-life balance. And that enabled me to still work full-time and actually work some overtime, just to help with the, the financial aspect of the program. So I appreciated that flexibility. Whenever I obtained my doctorate, I was able to work part-time and to obtain my doctorate in just 5 semesters. So it was a really, really quick turnaround time for me. And it was nice because, again, at that point in my career, I was ready to just focus more heavily on the program and get through that a little bit quicker and be able to move into the academic role. So I appreciate that you can really tailor the pace of the program to your life needs.
Mm-hmm. And the program at Pitt has actually changed a little bit since you came through it, with the opportunity for nurses to go right from their BSN through to the DNP in your area of specialization, which I think is a very exciting opportunity for nurses who know that this is the role that they want to have, and that way they while they may be working while they're completing their graduate studies, they are finishing in a shorter period of time, and at the end of the day, that's good for the country. That's good for healthcare, because it allows us to have really very well educated and well prepared practitioners who are able to offer a significant contribution throughout a very long career of nursing, which is very, very beneficial.
Yes,
Talk a little
absolutely.
bit about certification, if you can, and what's that like for CNS? Do you have to be certified? How do you get certified? Tell us a little bit about that.
Yeah, that's another great question, and I appreciate you bringing that up. I think there are two very important things that nurses need to consider with certification, and one is what we call title protection, and the other one is licensure. So as nurses, you all are working so hard, even as nursing students. And as advanced practice nurses, we're continuing to work hard each day to provide our patients with the best care that we can. So we don't want somebody who has not gone through that educational process and doesn't truly have the experience to be able to say that I am a clinical nurse specialist or a nurse practitioner. And it's not a matter of being territorial, but it's really saying, do you have that skill set and that knowledge to truly provide this service or to truly care for this patient population? So title protection is definitely something that we think about as a clinical nurse specialist, because we've not necessarily always had that, especially because the role is a little bit newer compared to some of our more established roles like the nurse midwife or nurse practitioner. The other aspect of certification is that it allows you to actually have a license. So I am not only certified, but I'm also licensed to practice in Pennsylvania as a clinical nurse specialist. And that helps me in my career because it clearly outlines my scope of practice. It allows me to, again, have that flexibility. So, for example, in Pennsylvania, clinical nurse specialists have a little bit different role than they do in Ohio. So I could actually function as more of a direct care provider and have prescriptive authority. And I think that just depending on what sphere of influence you would like to focus your career on, again, it's important that you have that support from your state nursing board. And it also is important to consider support from nursing organizations such as the ANA or American Nurses Association or the National Association for Clinical Nurse Specialists. So I do think that there are several benefits to certification. It also really helps to establish you as an expert in your field, which is, I know, what you are all working toward.
Great response, Melissa. That's really helpful and brings some clarity to that kind of confusing distinction between licensure and certification. So as we close up this terrific interview, tell me a little bit about what advice you might offer to either a nurse or a nursing student who is thinking about pursuing a career as a clinical nurse specialist in advanced practice.
Right. So I think that there are a couple of things that you can do that will really help you whenever you're thinking about the next steps in your nursing career. One of the things that I like that you had mentioned, Laura, is that you are able to go right from getting your BSN and actually start a doctoral program at the university. So that might not mean that you're necessarily working in the clinical practicum right away, but you can start taking some classes. We have some great clinical role practicums that actually teach you what a CNS does, and that will kind of give you a little bit of a flavor for what that role will look like. The other thing I would recommend is just getting connected to a CNS in one of your local hospitals. Many and almost, I would venture to say almost all hospitals have some kind of mentorship or shadowing program. that would actually allow you to spend a day or two working with a CNS. And I think that's really important to just be in that setting and be able to spend, even just a few hours seeing what those roles look like. And I think that those are two of the best pieces of advice that I could give. It's, don't be afraid to take that class or to spend a few days shadowing. It's going to give you so much information and really help you to see not only is the CNS role the right career choice for you, but also what you can do with that. One of the things that I love about being a CNS is that I don't have to get a new degree or a new certification whenever I want to switch roles or whenever I want to work in different clinical settings or in an academic versus a clinical setting. So it's really versatile. And I think it's very valuable to just be able to see that and have that hands-on experience.
Well, thank you so much, Dr. Melissa Harlan. You've given us a great perspective on the role of the clinical nurse specialist, and I suspect you may have some students calling you. So
I
thank
would
you.
certainly welcome the conversations.
Thanks very much, Melissa. Have a great day.
You too. Thank you, Laura.